Welcome back to RIA's VI Benefits Navigator. Whether you're active duty, a veteran, or a family member supporting someone who serves, this video is for you. Today, we're breaking down exactly how to access VA healthcare services in 2025. No fluff, just facts. We have five sections under this. Section 1, why VA healthcare matters. Section 2, step by step, how to apply. Section 3, filing a VA disability claim. Section 4, tips for a smooth process. And Section 5, final thoughts. Just a heads up, the remaining part of this video is a bit long, so feel free to turn the volume up and just let it play while you're doing your thing. Chores, driving, relaxing outside. You don't have to stare at the screen the whole time. Going with section 1, why VA healthcare matters. So, the VA offers one of the most comprehensive healthcare systems in the country, designed specifically for veterans and their families. From primary care to mental health, prescriptions to prosthetics, it's all part of the mission to serve those who have served. Get ready before you apply for VA healthcare. These steps can help you save time and avoid extra hassle. So here's a quick guide to help you get started. Step 1, check your eligibility. Step 2, gather your documents. Step 3, create or sign in to your VA account. And step 4, apply for VA healthcare. Simple steps that can save you time and help you get the care you've earned. First things first, are you eligible? VA healthcare is based on several factors: your service history, discharge status, income level, and whether you have a service connected condition. Let's talk about the first key factor on the list, your service connected disability. So, this simply means a medical condition that was caused or made worse by your military service. So, here are a few things to look into. Do you have a VA assigned disability rating, even 0% or higher? Is your condition one that's recognized by the VA? Have you already filed a claim and received a decision? And lastly, could you be eligible for the PACT Act for conditions related to toxic exposures? So, taking a moment to check these details can help you understand where you stand before you move forward with your VA benefits. The second factor is combat or hazardous exposure. So that means exposure to toxic substances or dangerous environments during service. Have you ever served in a place or role where you were exposed to toxic substances or dangerous environments like burn pits, Agent Orange, or during the Gulf War? If so, it's worth checking. Is your condition officially recognized as a presumptive condition under the PACT Act or TERRA guidelines? Have you signed up for a VA exposure registry? Have you submitted any medical evidence to support your claim? These steps can make a big difference in how your benefits are evaluated. So, we have the related links in the comment section, so feel free to check them out later. Next is your discharge status. So, your discharge status plays a big role in whether you qualify for VA benefits. So, let's take a closer look. Was your discharge honorable, general, or under honorable conditions? If it was other than honorable, has the VA reviewed your case under the new 2024 rule and made a favorable decision? Even if you had a bad conduct discharge, recent policy changes might still make you eligible for certain benefits. So it's definitely worth checking. Rules have evolved and you might qualify now even if you didn't before. Let us check your income level eligibility. Your household income can play a role in whether you qualify for certain VA benefits or whether you'll need to pay copays. Here's what to think about. Is your income below the VA's annual income limits? Do you have deductible expenses like medical bills or education costs that might lower your countable income? Are you already receiving a VA pension or other benefits that might exempt you from income screening? Even if your income seems too high at first glance, these deductions and exemptions can make a big difference. And here, the last factor to check for your eligibility for VA healthcare services: period and type of service. When and how you served can directly impact your eligibility for VI benefits. Here's what to think about. Did you serve during a recognized wartime period or in a combat zone? If your service was after 1980, did you complete at least 24 continuous months of active duty? Was your service type active duty, National Guard, or Reserve included under VA healthcare coverage? Different service types and timeframes come with different rules, so it's worth double checking. That closes step one in applying for VA healthcare services. Before we go to step two, send in your comment if you have any questions. Feel free to ask, and I'll be glad to answer them to the best of my ability, or you can call the VA hotline number or speak with a VSO. Right, so we have step two now, gather your documents. Before you dive into your VA application, it's a good idea to get your paperwork in order. Here's what you'll want to have ready and why it matters. So here are the types of documents together: your social security numbers, yours and your dependents if you have any, military discharge papers, your DD 214, insurance information like for Medicare, Medicaid, or private, and gross household income for last year. Social security numbers, yours and dependents. Make sure you've got the correct SSNs for yourself and any dependents, like your spouse or kids. Double check for accuracy. Even one wrong digit can cause delays. Include dependents if you're applying for family related benefits. Protect your info by using secure methods when submitting forms online or by email. Why it matters. The VA uses your SSN to verify your identity, link your service records, and track your benefits. For most veterans, it also serves as your VA claim file number. Military discharge papers, DD 214. Your DD 214 is your proof of service, so it's a must have. Can't find it? You can request a copy from the National Archives. Check your discharge status. It should be honorable, general, or other than honorable. Some exceptions apply. Review your service details. Make sure your dates, branch, and any combat or hazardous duty are listed correctly. Why it matters. Your discharge status directly affects your eligibility for VA healthcare and other benefits. Next together is your insurance information, Medicare, Medicaid, or private. Have your insurance details handy. Include provider name, policy number, and coverage type. Do you have dual coverage? The VA may bill your other insurer for non service connected care. Make sure everything's current. Expired policies can cause billing issues. Why it matters? The VA works with other insurers to help reduce your out of pocket costs and make sure billing goes smoothly. Last but not the least, gross household income for last year. It's time to gather your income documents. Include W 2s, 1099s, or tax returns for everyone in your household. List all income sources: wages, pension, social security, investments, rental income. Don't forget deductible expenses like medical bills, education costs, or dependent care. They can lower your countable income. Why it matters. Your income level affects your priority group, copay requirements, and whether you qualify for income based benefits or exemptions. We're done with steps one and two. Now let's go to step three, create or sign in to your VA account. So, all right, now it's time to get connected. Head over to va.gov and either create an account or sign in using login.gov or id.me, whichever you prefer. This step is super important because it unlocks your personal dashboard, giving you access to everything in one place. Once you're signed in, you can apply for healthcare and disability benefits, upload documents and track your claim status, schedule appointments and message your care team, update your personal info, and manage payments. It's like your digital command center for all things VA. And the best part, it's secure, easy to use, and available 24/7. So go ahead, get set up, and take control of your benefits journey. We're down to the last step, apply for VA healthcare. Now that you've got your documents ready, it's time to apply for VA healthcare. And good news, you've got options for how to get it done. You have online, by mail, in person, or with the help from a veteran service organization or VSL. Let's break it down. Online submission. Fastest and easiest? Definitely online. Just head to va.gov slash health care. This is the official site in the application for healthcare. Then sign in using login.gov or id.me. Fill out your personal info, service history, insurance, and income. Upload any supporting documents like your DD 214 or income proof. Double check everything before you hit submit. Typos can slow things down. And don't forget to save or print the confirmation page for your records. Tip: online is the quickest way to get your application moving. In person submission if you want to talk to someone face to face. So visit your nearest VA medical center, bring your completed form or fill it out there. Have your documents ready, originals or copies. Ask for a receipt so you have proof of submission, and don't hesitate to ask questions. VA staff are there to help. And tip: in person is great if you want immediate support or clarification. Next up is mail submission if you prefer paper. That's really no problem. What you do is download and fill out VA Form 10-10 Easy. Use black ink and write clearly. Include copies of your DD 214, insurance info, and income documents. Mail it to Health Eligibility Center, 2957 Claremont Road, Suite 200, Atlanta, Georgia 30329. Use certified mail or tracking so you know how it got there. And tip: always keep a copy of what you send just in case. And now the last option, with the help from a VA accredited rep or VSO. This is if you're not sure where to start. A VA accredited rep or a VSO can walk you through it. What you need to do is find one near you using the VA VSO directory. Second, schedule a meeting or drop in. And third, bring your SSN, DD 214, insurance, and income info. They'll help you fill out the form and make sure it's complete. Plus, they can answer questions about eligibility and next steps. Also, a tip: VSOs are trained to help you avoid mistakes and get the most out of your benefits. Right, we are now on section 3, filing a VA disability claim. If you have a service connected condition, meaning an illness or injury caused or worsened by a military service, you may qualify for disability compensation. Filing a claim not only helps you receive monthly payments, but it can also improve your eligibility for VA healthcare and other benefits. So step 1 in filing for a disability claim is to gather medical records. What to do? Collect service treatment records from your time in the military. Include civilian medical records if you received treatment after discharge. 3. Get doctor statements or nexus letters that link your condition to your service. But for initial direct claims, you may not need a medical evidence or nexus or DBQ from outside yet. The VA will first check your in service records and most likely schedule you for CNP exams. Getting one from outside is completely up to you, though. Now, why it matters to get medical records? These records prove your condition exists and show how it's connected to your military service. All right, step 1 is out of the way, so let's go to step 2. Choose your claim type. Now, before you hit submit, you'll need to decide what kind of claim you're filing. The VA gives you two main options, and the one you choose can affect how fast your claim gets processed. We have standard claim and fully developed claim. Let's take a closer look at what sets them apart. So, what is a standard claim? This is the traditional route. The VA helps gather evidence for your claim, like medical records or service documents. It's a good choice if you don't have everything ready yet or you're not sure what's needed. Just keep in mind, it might take a little longer since the VA has to track down those records for you. Tip: go with a standard claim if you're still pulling your paperwork together or need help collecting evidence. And now let's have fully developed claim or FDC. This is the fast track option. You submit all your evidence upfront: medical records, service documents, anything that supports your claim. Because everything's already in place, the VA can make a decision much faster. It's perfect if your case is straightforward and you've already got your documentation lined up. Tip: FTCs are ideal when you're confident your paperwork tells the full story. So, question: is there a separate form for each type? No, there isn't. So, the difference isn't the form, it's the process. If you've got your paperwork ready, go the fully developed route. If not, the standard claim lets the VA help you fill in the gaps. Need more time? Use the intend to file option. If you're filing your disability claim online but still gathering your documents, here's a helpful trick. When you're filling out VA Form 21 526 Easy, pause when you reach the Continue button. Don't click it just yet. At that point, the system will automatically trigger an intend to file. You'll see a message confirming it on screen. What does that mean? It gives you up to 1 full year to collect all your supporting documents like a nexus letter, DBQ, or any medical evidence from outside the VA. Once you've got everything ready, you can log back in, pick up where you left off, and hit continue to finish your claim. Tip: this is a great option if you're waiting on paperwork or working with a private doctor. It locks in your potential start date for benefits while giving you time to get organized. Hey, are you still with me? So, step three is submit your claim. Now, there are three options: online via va.gov, in person by visiting a VA regional office or getting help from a VA accredited representative or Veterans Service Organization VSO, and last option is by mail. So send completed VA Form 21 526 Easy to Department of Veterans Affairs Claims Intake Center, P.O. Box 4444 in Janesville, Wisconsin 53547 4444. So, what happens after you file? VA reviews your claim and may request a compensation and pension or CNP exam. You'll receive a decision letter with your disability rating 0 to 100%. Ratings affect your monthly compensation and healthcare priority group. Now we're down to the final section of the general topic: VA healthcare services. We have tips for a smooth process. All right, here are a few quick tips to make your VA healthcare application go smoother and some small mistakes you'll want to watch out for. Number one, double check your documents. Make sure your service details, social security number, and contact info are all accurate. Tiny errors can slow the process down. Number two, use direct deposit for faster payments. If you qualify for travel pay or other reimbursements, it's faster and safer. Number three, keep copies of everything. Save a copy of your completed VA Form 10-10EZ, the application form for VA healthcare, and any documents you submit. Having your own record makes follow ups much easier. Tip number four, follow up regularly through your VA account. Don't forget to log in to your VA account once in a while to check your status. That's how you'll know if they need more information from you. Right, accessing VA healthcare isn't just about paperwork, it's about getting the support you've earned. Whether it's a routine checkup or long term care, the VA is there for you. A word of thanks. So, thank you so much for being with me till the end. If this video helps you, give it a thumbs up, share it with someone who needs it, and subscribe for more weekly content on VA benefits, veteran support, and family resources. Till the next